Good afternoon, Senator Edwards. My name is Nicholas Owen, and I'm a speech communications major here at Howard University in the Johnny Johnson School of Communication. And I want to know, since you are a lawyer, Viacom just sued YouTube for $1 billion citing copyright infringement. And I want to know what can you assure us as young people that you can protest against the big media, traditional media, against new open source media?
I saw the story about this lawsuit, but I haven't actually seen the details of the lawsuit itself. So I don't know a lot. I don't claim to be an expert in this particular case, but I think information vehicles like YouTube, the internet at large, blogging, video blogging, all these things are ways for democracy to flourish. They're ways for ordinary Americans to participate in the process, and that means that we have to be very careful. There's a debate going on in America right now about something called net neutrality, which goes to this very issue. And I'm a strong believer in net neutrality, and I think it's what we want to do is we've become increasingly, people like me have become increasingly concerned by the loss, by efforts to squash grassroots media, and particularly some of the things that happen over the internet, because that's the way for ordinary people's voices to be heard. And the consolidation of the media is an equally disturbing thing. The consolidation of the media vertically, so that what you end up with are these big conglomerates that dominate so much of the media. So I think we need multiple things. Number one, we need a strict, serious enforcement of antitrust laws. Number two, we need net neutrality. Number three, we need a President of the United States who speaks out and is very vocal about the importance of all the things that we've just talked about. And not just in terms of people getting the information they need, but this goes to the heart and soul of democracy. You know, if democracy is going to work in this country, then we want people to be well informed, and we want a wide variety of diverse voices to be heard. And that's what's at issue with these conglomerates, these media conglomerates. So I think we can do all those things, but we really have to stay on top of this, because what we see flourishing at the grassroots could be stomped on if we're not careful. How about this gentleman? Yes, ma'am. Right here. With your camera.
I was going to ask about healthcare.
Okay. I'll be glad to. I was hoping someone would ask. Basically, my health care plan is a truly universal plan. Everybody in America will be covered. It's based on the idea of shared responsibility, which means employers have to cover their employees or pay into a fund. The government will set up health care markets around the country. And the way you visualize this, if you're a consumer, then what you'll be able to do is go into those markets and choose what kind of health care coverage you want. And from whom? There'll be private insurers, and the government will be there too. So, for example, you could choose a Medicare single-payer kind of health care plan. The gaps in our health care system are largely eliminated. There's total mental health parity. Mental health is treated exactly the same way as physical health.
That's awesome.
There is chronic care, long-term care, basic dental is covered, eye care is covered. So the idea is to fill in some of these gaps that exist in our system today. And then there's efficiencies that are created that don't exist today, because we spend 30 to 40 cents of every healthcare dollar on administrative costs. So we dramatically bring down administrative costs, mandate the use of technology, mandate the use of electronic record keeping. We subsidize the cost of health care. Low-income families are completely subsidized. As your income goes up, well, I see eyes starting to glaze over already. As your income goes up, the subsidy goes down. And on the issue that many of us have been concerned about of job lock, which are people being stuck in their jobs because they're worried if they change jobs, they can't keep their coverage, or they have a pre-existing condition, some problem like that. There are no pre-existing conditions in this health care plan. They don't exist. If you have your health care in one of these markets, and you either get laid off or transferred, or you just decide to change jobs, you can take your health care coverage with you. So, I do want to talk about one last thing about this because it's the part that our leaders sometimes don't want to deal with. There is a cost associated with universal health care. It's going to bring down health care costs for everybody, and it's going to cover everybody who doesn't have coverage. Those are great things. But it's not free. It never would be. My plan costs $90 to $120 million a year. I think it's worth it, and the way I pay for it is by getting rid of Bush's tax cuts for $50 million.